Good day everyone, I am BERACTANT. My generic names are BERACTANT, A60G86X, Bovine Lung Surfactant Extract, Surfactant Bovine, Surfactant TA, and Uni S866045PIG. My brand names are Survanta, Survanta Intratracheal, Alveofac, Bless, Newfactant, Surfactant B. Richer, and Surfactant. My chemical name is a modified bovine lung extract containing mostly of phospholipids, modified by the addition of this. Now, let's talk about my drug classification. My therapeutic drug classification is lung surfactant. Then my pharmacologic drug classification is bovine lung extract. Now, let's talk about my pregnancy category. Sad to say, none is identified in this category. Now, let's talk about my mechanism of action. I replenish lung surfactant and restores surface activity to the lungs by lowering surface tension on alveolar surfaces during respiration and stabilizing the alveoli against collapse at resting transpulmonary pressure. Now, let's talk about my pharmacokinetics. First is the absorption. I am administered directly to the target organ, which is the lungs. Here is where biophysical effects occur at the alveolar surface. Most of the administered dose becomes lung-associated within hours. Next is the distribution. Here, drugs is distributed across the alveolar surface by intratracheal administration. Next is the metabolism. Here, lipids enter the endogenous surfactant pathway of recycling and reutilizing. Lastly, the excretion is where the alveolar clearance of lipid components is rapid. Next is the indications. I am used by prevention and treatment of respiratory distress syndrome or RDS, hyaline membrane disease in premature infants. Survanta significantly reduces the incidence of RDS, mortality due to RDS, and early complications. So, I'm also used in premature infants less than 1,250 grams on birth weight or with evidence of surfactant deficiency. When this happens, give Survanta as soon as possible, preferable within 15 minutes of birth. In rescue, to treat infants with RDS confirmed by X-ray and requiring mechanical ventilation, give Survanta as soon as possible, preferable by 8 hours of age.
My name is Cabataña and I will be your nurse for today. And for today's topic, we're going to talk about the contraindications, side and adverse effects, and the nursing interventions of the drug BERACTANT. BERACTANT is contraindicated to patients with bovine protein hypersensitivity, bradycardia, sepsis, neonates, pregnancy, and lactating mothers. The side and adverse effects: in the respiratory system, lung consolidation, blood from the endotracheal tube, deterioration after weaning, respiratory decompensation, subglottic stenosis, paralyzed diaphragm, and respiratory failure. In the cardiovascular system, hypotension, hypertension, tachycardia, ventricular tachycardia, aortic thrombosis, cardiac failure, cardiorespiratory arrest, increased apical pulse, persistent fetal circulation, air embolism, total anomalous pulmonary venous return. In the gastrointestinal system, abdominal distension, hemorrhage, intestinal perforations, volvulus, bowel infarct, feeding intolerance, and hepatic failure. In the central nervous system, applied are seizures. In the endocrine and metabolic system is adrenal hemorrhage, inappropriate ADH secretion, and hyperphosphatemia. In the musculoskeletal system is inguinal hernia. And these are the nursing interventions. Before, evaluation of possible contraindications and cautions, screening for birth and accurate weight to determine the appropriate doses, as this medicine is used as an emergency treatment. No contraindications need to be screened for. Conduct of physical examinations to establish baseline data to evaluate the effectiveness of the drug and the occurrence of any drug therapy-related adverse effects. To evaluate perfusion, assess the skin temperature and the color. Curing. To evaluate the efficacy of the drug and drug delivery, monitor respirations, adventitious sound, placement, and patency of the endotracheal tube and chest movements. Blood pressure, pulse, and arterial pressure are evaluated to monitor the infant status. To track drug effectiveness, evaluate blood gases and oxygen saturation. To monitor for sepsis, assess the temperature and complete blood count. It is suggested to preserve respiratory function and increase the effects in premature infants. Incorporate chest physical therapy procedures such as positioning, suction, and chest percussion or vibration. After, within minutes of administration, marked changes can happen. To prevent hyperoxygenation for exposure to excessive peak and respiratory pressures, ventilation settings will need to be constantly reviewed and changed post-administration. For certain neonates, extubation can be taken into account, particularly for the premature neonates who are on CPAP before administration and reacted well to the administration of the surfactant. Carefully track the vital signs of client for every 30 minutes in 10 minutes, then restore usual monitoring frequency. Unless signs of severe airway obstruction occur, do not suck airways in 1 hour after installation of surfactant. Note and report changes that may indicate a significant changes in non-pulmonary hemodynamics on unwell patients.